Mpox, formerly known as monkeypox, is generally less severe and less contagious than other diseases like smallpox or COVID-19, but it can still be dangerous and lead to death, particularly for certain groups. In August 2024, the World Health Organization declared the Mpox outbreak a public health emergency of international concern. There has been an upsurge of Mpox in the Democratic Republic of the Congo and a growing number of countries in Africa. Sweden and Pakistan have both reported cases of Mpox, days after the World Health Organization declared the virus an emergency. Mpox is primarily spread through close contact with an infected person or animal, or through contact with contaminated materials. It can spread through respiratory droplets, though it is not as easily transmitted this way as diseases like COVID-19. Gay, bisexual and men who have sex with men may be at higher risk of being exposed to Mpox if they have sex or other forms of close contact with someone who is infectious. Mpox causes symptoms like fever, headache, muscle aches, and a rash that turns into pustules. These symptoms typically last 2 to 4 weeks. While most cases are mild and resolve on their own, Mpox can lead to complications such as secondary bacterial infections, respiratory issues, sepsis, eye infections, and in severe cases, encephalitis, inflammation of the brain. People with weakened immune systems, such as those with HIV, AIDS, cancer, or who are on immunosuppressive medications, are at higher risk for severe disease. Young children, particularly those under 8 years old, are more susceptible to severe symptoms. In pregnant women, there is a potential risk of the virus passing to the fetus, which can lead to complications. The mortality rate of Mpox varies depending on the strain. The West African strain, which was responsible for the 2022 outbreak, has a mortality rate of less than 1%. The Central African strain, which is responsible for the 2024 outbreak, can be more severe, with a mortality rate of up to 10%. While Mpox does not spread as easily as some other viral infections, outbreaks can still be significant, particularly in communities where vaccination coverage is low. There is a vaccine available that can prevent Mpox, and this is particularly effective if administered before or shortly after exposure to the virus. Supportive care is the main treatment, and antiviral medications like tecovirimat, TPOXX, may be used in severe cases. Mpox is not as dangerous as some other viral infections, but it can still pose significant risks, especially to vulnerable populations. Prevention through vaccination and awareness is key to managing and reducing the impact of the disease. Please remember to like, subscribe, share and comment.